All right, I think we will start. Good evening. It's my pleasure to welcome everyone to Keeping It Local, a monthly series from September to April, hosted by the League of Women Voters of Champaign County, to focus on local issues with local experts as presenters. You can join us by Zoom at 7 p.m. on the fourth Wednesday of each month. Information about upcoming Keeping It Local programs is on our website. I'm Teresa Michelson, a member of the program team that plans these presentations. Our topic this evening is the Champaign-Urbana Public Health District, a long-standing and valuable asset to our community. The district faces challenges. How is it faring now? And with its proven resiliency, how can it continue to move forward? We are honored to have with us tonight Julie Pryde, the Public Health Administrator of the Champaign-Urbana Health District, who knows more about these matters than anybody else. Julie Pryde holds a master's in social work from the University of Illinois, Urbana-Champaign, and a master's in public health from the University of Illinois, Springfield. She has been with the CU PhD for 30 years, and her current leadership position she has been in since 2007. I could go on and on, but we want to get to Julie and your questions. Julie's opening remarks will not be long. She welcomes your questions. You can put them in the chat, and Emily, one of our Zoom operators, will ask them. Julie, the floor is yours.
All right. Well, thank you for having me here tonight. This is one of my favorite groups always to speak with because you are all so engaged in everything. I will start by saying that this is the absolute craziest time that I've been involved in public health. I started as a student and as a volunteer with CU Public Health in 1988, working on HIV/AIDS issues. That was, during an ugly period as well. But it is nothing like this level of just. It seems to me like there is just an effort to dismantle the successes of public health system and to sow seeds of misinformation and disinformation, and it's really causing harm. When I started back then, if you had told me I would still be dealing with, well, first of all, I thought AIDS would, back then I didn't think AIDS would ever go away. And now we're to the point through amazing, years of effort at the federal level, the CDC, NIH, local levels, state levels. We're to the point now where we are basically able to get to zero. We have the tools, we have the everything we need to do that. We have PrEP, we have medication to prevent it, we have medication to keep people healthy once they have it and keep their viral load low. And, now that's being dismantled. It was first dismantled, taking money away from, U.S. aid. It's the public health is a worldwide program, so we can't just talk about, the U.S. or Champaign or Illinois and think that that's going to matter in the long run. But if you had told me back then I would be dealing with syphilis and TB, I would have thought you were, crazy. I thought that would be pretty much taken care of. But, TB, right now we have a higher caseload of TB than in my entire career. We are constantly living in fear of like multi-drug resistant TB coming into our population here, and us getting a case of that just because of the cost and the what's associated with that. With syphilis, we have seen in the past several years, we have seen congenital syphilis. And if you don't know what congenital syphilis is, we've also seen, tertiary syphilis, but congenital syphilis basically means that if you have that, you have had zero prenatal care, because that's how you get it. So even though, there's lots of we know how to prevent syphilis, we know how to treat syphilis, and it's relatively easy at the start. We're now seeing people not having access to health care, so they're coming in with having babies when they have syphilis, and that causes lifelong problems. It can. So what we're seeing is I feel like my career has been like, maybe started a little bit lower, but we saw such amazing things happening in public health, and then boom, we got this mess. RFK Jr. I couldn't, if this thing was 6 hours long, I could continue talking just about everything that he has done that is idiotic, and is, he's not only is he incompetent, but he is he's a menace. There's really nothing else to say. We're seeing places taking fluoridation out of water. We're seeing vaccine rates plummet. We're seeing barriers thrown up so people can't get care, and that type of stuff. Never have we seen it to this degree. Never. We've seen attacks on certain things always, but nothing like this. Do I think we will survive it? Yes, absolutely. We will get through this. The funding cuts that have been threatened and have indeed happened, we're not going to see the fallout from that for a long time, because it's decimated for example, the communications at CDC. It has, research is on hold, and those are the things that the whole entire profession of public health, those type of important things, they all work together. And when you're not having the research being done to help inform, people in the field, that's a problem. So, and God help us if we get another pandemic, and one is certainly knocking right at our door. Bird flu is just ripping along. Right now, it's not transferring to humans, but it is definitely going around in animals and in multi-species. So we have here locally, we have taken really little in actual hits to our programs. There have been a couple that have been canceled, but the staff have scrambled and they have looked for other funding sources. And in the past, since he's been in office, we've probably brought in over $250,000 in different grants that we can use to supplement some of those, areas. So the state of CUPHD, I can say, is going pretty well. We have a 99,000 square foot building that is paid off. It is an asset for our community, so we can use it for, any number of things. We have people who lease space from us. We have a wonderful finance and HR department, which is, any of you who know, that's like, if you don't have those, you cannot get the big grants. You cannot do the big programs, no matter how wonderful your staff is. You have to be able to take care of those things on the inside. And, so CUPHD is, I'm proud to say, very strong. We have a strong fund balance. We have wonderful grant writers, a lot of talented younger people here and older people, but we have a lot, a whole new crop that are coming in. And so we still have our wonderful connections with the University of Illinois. I cannot never say enough about that, and how lucky we are in the community with those. We have connections with Parkland and all those things. So where we knew this was coming, and so we did what we've done in other kind of, we call them downturns, but what we do in that situation is we look to other funders. We will not take a grant that comes with any ridiculous strings that make us do our jobs in a way that is either unethical or against the science or anything like that. And luckily, we live in a state where the governor and the head of IDPH feel the same way. So, when they targeted our family planning money and tried to get us to do something that was ridiculous, state of Illinois just said, we'll take care of it until they, until things get back to normal. So, we're in a great state and we're in a great community. So that's what's keeping us going. Do you have some questions, or do you want me to? I don't know how much you want me to yammer on. I can just talk about CUPHD forever. I'm most proud of my children, but second of all, I'm most proud of CUPHD and how far it has come. And I'm not even going to pretend that I can take credit for that. We have an amazing staff here and amazing community and a lot of partners, and that's how you get things done.
I have a question, Julie. Someone new coming to the community, what would you tell them are maybe the 3 or 4 most important things? I know it's hard to prioritize that the health district does. They might come from another state where the services are very poor, they haven't had experience, that sort of thing.
Yeah, well, I always try to get people to look at the services that we list, on the website. But I will say, and let me see who's trying to see on here. If anybody, well, I was going to talk about, so public health, when public health first started, we behind the scenes it was called Public Health 1.0, but of course nobody called it that. But that was when the profession was just getting going and they were trying to get the science behind the public health. So this was like, at the very start of public health as a career, and not as a career, but as a occupation type thing. So, or a profession, I'm sorry. So what we saw then was just trying to get the profession up. This was long before me, but trying to get the science, the epidemiology, the underpinnings that moved it along. And then for all my entire time that I have been here, we have been in what's called Public Health 2.0. And the idea behind that is to get the services out to where clients need them. That's your home visiting programs, that's your outreach programs, that is mobile programs, all that type of stuff. And then we have where we're going now is Public Health 3.0. And that is where we're going to start seeing something different at public health. So rather than us doing services, because why do you need to come to a public health department for an STD test or for family planning? If you're in a community like this, you don't need to. There are plenty of places. We have federally qualified health centers. We have, clinics. We have Planned Parenthood here. There's no reason to have to come to public health. So, so the goal is for us to move away from doing services like that and focus all on prevention and all on data, and being a community health strategist to help bring members of the community together to solve the more entrenched problems. Sort of like you saw during COVID, only this would be for other problems, whether it's housing or whether it's food insecurity or whatever it is. That we would be more conveners and providing data and resources like that. But as far as the services that we have, are probably one of our most popular ones, which won't go away, is WIC. It's just housed here, Women, Infant, and Children Program, and the Child Dental Program. The Child Dental Program is huge. Ideally, that would be done by a federally qualified health center, but we have to be in a position where we know that an FQHC is stable and can take that over and keep it going, because there's too many kids that rely on that in this community. We have environmental health services, which are the ones, the safe food, safe water, septic system inspections, things like that. The vector-borne diseases like, mosquitoes and ticks and those type of things. We do surveillance and testing with that. We have wellness and health promotion. They do medically accurate, comprehensive sex ed in the schools. And we have, they're also have the dental program under them. They do tobacco related things. We have teen and adult services. Right now they have the family planning. They have the naloxone or the harm reduction program. syringe exchange program that we've had for well over 20 years. People are always surprised by that. And I said, well, the reason you don't know about it is because you didn't need to know about it. If you needed to know about it, you would have. We would have found it, we would have had you know about it. But it was a way it was too controversial, and we were not wanting to deal with that. We knew it was the right thing to do, and we knew it was science based, and it was effective, and we did it. And that's why we never really saw the big spike of HIV and viral hepatitis in injection drug use community like a lot of places did. So so we have all kinds of programs. We have I said we have the family planning program over there as well, the STD clinic. We have a large communicable disease team. And so that is important. Is education mission important for CUPHD?
I was going to read some questions, but I didn't keep up with it.
Okay, go ahead. I'll stop yammering. Go ahead.
No, it's not good. You were just reading the most recent one. I wanted to go back because I thought it kind of tied into what you were saying earlier. Patricia has a question about, does the CDC making changes to their immunization recommendations change how you guys are following previous guidelines versus newer ones? So where does the guideline come from today? Is it previous ones, or is it the updated CDC ones? And
that's a really good question. So usually how it works is the CDC they take the recommendations, from ACIP, Advisory Committee on Immunization Practices. Forever, that has been the group of experts that look at all the data, all the research, and say, this is how you need to do vaccination. And forever, that has been, that's where all the experts are, and that's been the go-to. And it was sort of a seamless thing. They would be recommended by CDC, then the insurance companies would bless them with their, going to pay for them, or we would get access to them. With this, RFK Jr. came in and immediately fired everyone on that group. These are the top experts. He fires them all and replaces them with wingnuts, and who believe that, feathers and crystals are what is going to be better than vaccination. So, what happened, though, is that we didn't just say, oh, well, now we'll start listening to these wingnuts because that's what this administration is telling us to do. No, what happened is all of these experts are under, they're still, I think they're called now the Vaccine Integrity Project, and they are up there not physically, but they're at CIDRAP at the University of Minnesota, which is a wonderful, they have the wonderful program up there, and they are still reviewing everything, and they are making recommendations. So we actually have two separate sort of recommendations and things going on. One that's done by experts and that have always been doing it and that are making the recommendations that thankfully our state health administrator and director listen to, and governor. And then the other wingnutty stuff, and places that don't like vaccinations, they're able to use that as an excuse. Well, they'll throw up all these barriers. Illinois, the governor and IDPH have allowed us to go around a lot of those barriers. They've created their own recommendations based on the Vaccine Integrity Project, and the barriers have been removed. Early on, we were talking about what happens if we don't get our free, and they're free to us. So they're called 317 or Vaccine for Children. That's how we get people who have no ability to have insurance or have no, who are underinsured, and they have some kind of crappy thing that won't pay for vaccines. We're able to get everyone vaccinated that wants it. So we did have that. We were worried that we were going to really have to sink a ton of money into that, but it finally came out, and we have it, and it's available. But we had figured out how we were going to do it without that. So, so there's basically two. This is a really weird thing. It's an amazing study going on where you have people doing science-based public health and you have people who are doing magical thinking based public health. And then you're going to see, which states are faring better than others. And that only works to a certain degree with things like fluoridation. But when you get into infectious diseases, that causes problems everywhere.
That ties into a question earlier. Can you talk about the loss of faith in the public health system that brought us to this point?
Yeah, it was it's a
Yeah.
coordinated, in my opinion, attack of disinformation. It was just steadily drumming along. What happened during COVID is that people saw what goes on behind the scenes in public health research and what goes on at the CDC because it was happening, it was happening in real time. And we were dealing with something that we weren't ready to deal with. Had this been a flu pandemic, everything was there. We've been practicing for this forever at the, worldwide. So the flu comes in, you have the vaccine, platforms ready and all that, and you just zip along. But with COVID, what we didn't know, this was a different, so it was a coronavirus. We only know of the coronaviruses that are out there, right? So you have to cast the net wide. So you have to say at the beginning, we don't know, therefore this is what we're going to do. And then as the research catches up, then you start paring it down to where you get what the final recommendations are. But at the beginning, what they were seeing was stuff that's usually done over years and years and decades and stuff, when it's certainly been done with flu. But because it was a novel coronavirus, it really let people kind of look behind the scenes, and they're used to just getting information out there and then sticking with it, like get your flu shot. And then, but with this, so you had the questioning going on because they were seeing this changing guidance, which we knew was going to happen, but it wasn't, the public didn't really understand that. And it just was made worse by then coordinated disinformation campaigns, which are still going on.
Yeah, that kind of ties into a question from Sarah Kelly about, if you mentioned talking about concerns with bird flu that's transmitted animal to animal interspecies, but not yet jumping to humans is a concern. What do you recommend we do differently? She wants to know, not only on a local level, but on a state and federal levels to prepare for, the incidence of a pandemic in the future.
Well, it's the same thing to prepare for any pandemic, and it's it's like individual. What we can do is just the same thing we would do when COVID happened, is that you're ready to stay home if you have to stay home for a little bit of time, and be ready for that. But you need to have trust in the vaccinations and listen to trusted sources. That is the key. And with the internet and the social media, it just got completely out of control with misinformation. But what needs to happen for the whole thing, talking about pandemic prevention, is we need to understand that we are one world, and that is a public health term too. Human health, animal health, environmental health are all connected. Most of the infectious diseases that we deal with are zoonotic. They're coming over, from animals. But you can't just worry about the U.S. or Illinois, or whatever. It's the world. So when we are having wars, and when we're having famine, and we're having all this stuff going on, is famine, and people are having to go look for food in more and more places, and we're getting more and more exposed. We're not taking care of the environment. That is causing just horrific things. We can see it here all the time. So what needs to happen is so big that we all know what to do. but we can't do it. We can't do it ourselves. And it's frustrating that I feel like we're wasting time going backwards, things that we've already taken care of. We're dealing all the time with emerging infections. We don't need to deal with re-emerging infections. And for the love of God, we do not need to deal with vaccine preventable diseases coming back and taking over. I mean, it just, there's only so much, there's only so many resources, there's only so many, there's only so much you can do. So when you have something that works, you shouldn't be screwing around with that. You should be going on, worrying about the other things. Climate change is a big one. And it's just, again, it's so much bigger that it's hard for me to talk about it because it's just so massive. It's not like I can do anything specifically about it. We did cover the health department with solar panels, however, so we're doing our little tiny part.
That's
But
awesome. I have an appreciation I wanted to share from one of the members of the meeting. Thanking you for the environmental health work specifically that you guys do at the health department. And also sincerely appreciating the inspections of restaurants and places to eat around town, giving people the confidence that when they go somewhere to eat, they can know that it's safe. Or if it fails an inspection, I know that's also the gossip and rumor mill. I was like, oh, did you hear about so-and-so? And so thank you. Everybody cares about that. Also, when you talked about giving information to the community, I remember you going on WEFT and doing interviews with the AMINs during the pandemic and talking straight to the people in the community. So I really feel gratitude for that as well, that connection. So a question has come up. What questions should we be asking for candidates who are running for office that are related to public health? What should we be contacting our already elected officials about in particular?
well, I'm trying to think of a way to diplomatically say this, but there does tend to be a group of politicians who are more friendly towards public health. But you want to know that people are dealing with reality. I mean, that's the first thing. I mean, they need to know where to get information and where to ask. And I will say that I have been so incredibly lucky in this community. When Scott Bennett used to get questions, when Carol Ammons gets questions, when Nikki Budzinski gets questions, when Paul Faraci gets questions, you know what? They actually call public health. They will actually call me and ask, instead of just like, oh, well, guessing. They'll say, hey, how is this going to impact you? How's this bill going to impact public health? Explain to me how this works. And that is amazing when you have something like that, when people will actually try to listen and understand how something works. That's amazing. So that's the one thing I would ask. First of all, is what do they know about, what do they understand about public health, and what would they do if they got something on there? Nobody's an expert in everything. So if you get questions about it, or you're expected to vote on a bill, go talk to the people that it will impact. Go talk to the people who work in that area. There's so many weird bills, the raw milk issue. Again, something I never thought I would deal with. People are like, let's stop drinking pasteurized milk and let's start drinking unpasteurized milk so that we can get all of the pathogens that have been taken care of. Let's bring back tuberculosis from cows through milk, because that was actually one of the reasons in 1937 that a group of women that were League of Women Voters helped to start CUPHD. A bunch of people in our community decided that they demanded safe food, safe milk, and well, at the time, venereal disease prevention. So, but they wanted that's taken care of, and that was the very beginning of public health. The very beginning of the whole profession type of thing. So it was it's just people demanding what they deserve, what they should have. And the good thing about our community is that we tend to look out for others. And that makes it good for public health. Because like I said, you can't just say, okay, all of you with insurance, we're going to worry about you, and everybody else, I guess that won't affect us if you don't get vaccinated, or if you don't get cancer screenings, or if you can't get this, because it does, and it impacts us all. It impacts our community and our community's well-being. So
I'm curious
it's
if you could
important.
speak to, you mentioned insured versus uninsured as groups.
Mhm.
When I think of public health, I assume most of the people who are coming through receiving services from you guys are uninsured or underinsured. Is that the case? Or do you also
Nope,
see a fair amount
that's
of clients who
it's
get services who are insured?
so again, we're trying to move away from services to where we will be really only doing, let's say there's an outbreak. Anybody should be able to go and get whatever test they want, and they can go to federally qualified health centers. That's the places. So in our community, Francis Nelson Health Center slash Promise Healthcare. I'm clearly never going to be able to just call it that, but just I'm so used to calling it Francis Nelson still. But anyway, we have that. We have community health partnership. Uh, so there are places for people to go and programs that are set up for them if they don't have insurance. Um, who we would like to just see is if there's an outbreak, there's tuberculosis, one case of tuberculosis. I can't even tell you how much work that is involved in that. I mean, I think people would be very surprised if they understood how much time is required for one tuberculosis case. And we have, right now a record number here. And so what we do is testing related to that. So if we go out, there's a workplace exposure, or there's a shelter exposure, or there's a home exposure, we go out and try to get people tested and things like that. Same thing with STDs. All the reportable diseases come to us, that's where they're reported to. So every disease has an algorithm, and that we have to then follow. So that's what we need to focus on, is really going after those type of things, and focusing on the outbreak mitigation. I mean, we do that now, but we need to try to work closer and closer with our providers to do things that maybe aren't even reportable diseases. So if you have like salmonella, or you get plague, or you get, various STDs, certain ones, that's all reported to us, and then we have to do something with it. But there are other things that, like latent TB, for example, if we can get to people that have latent TB, if they're reported to us, even though it's not mandatory, we can talk to them and explain to them that, hey, if you get on this medicine that we're going to provide for you, and take it for however long, you can prevent yourself from getting a case of active TB. Therefore, you won't have to be off work. You won't have to be in isolation. And isolation is hard. It's hard for people, especially younger people. It's very, very hard for them.
Thanks. You've got
I have a follow-up question on what to ask people running for office. I mean, so what would be a question or two that would sort of ferret out somebody who is, like, as you say, one of these wing nuts, right?
Are you vaccinated? That's kind of become, honestly, it's not, are you vaccinated? Because most of them are vaccinated, but now they don't believe in it. But I don't even know. I mean, I don't know, but
I mean, something as simple as, are you in favor of the public being vaccinated for, long-standing diseases?
yeah, I mean, yeah. What are your feelings on, oh, here's one. What do you feel about mandatory vaccination for school, for example? Because that is what has really gotten the infectious diseases down in this country, as the vaccine preventable ones, is school age vaccination schedules. All the kids are in some type of school. They get the vaccinations, and it really holds the diseases down. And unfortunately, the people are going to find out now that just because maybe their kids haven't been vaccinated, it was no big deal because most everybody else was. But once you lose that herd immunity, and there'll be tragic uh, situations coming from that, and it's awful. It's really, I'm old enough that I had those diseases, a lot of them, and they're not, I survived them, but I know that somebody that had it at the same time as me, mumps, lost hearing. And I've certainly known people who have lost children back in the day to that. So,
No, Emily, go ahead. You can go back to, I just wanted to get a
Yeah,
nail.
no, I'm glad we kept it going. Ruth has a question about how concerned should we be that the FDA will continue to reliably review and approve new vaccines and boosters using evidence-based science?
right now, I am, and this is the first time I've ever said this, has been this year, but I am nervous about things, and so is everyone else that is coming out of the FDA and the CDC, because they are just, and NIH, because they're just doing crazy things. It's like they have these beliefs that are not based in reality, and some may have like a kernel of truth about them, um, but the issue is that it's like they got the keys to the candy store and they're just throwing out everything that makes sense, and putting in everything that doesn't, and like changing the rules. So it's really scary. So I don't know. I put my faith in the experts. That's a vaccine integrity, project. There's a shadow FDA too. So you just have to know who to listen to. It's, yeah. Somebody said there's no logic in their actions. Yeah, that's true. That's what makes it so disorienting and so scary. But you do have to know that there are the shadow groups that are out there. They're still functioning. Universities are taking the databases that they're trying to destroy. They're getting them. Other places are getting them. So the stuff is still there, and the experts are still there, and the people are still there. And if they're not being funded, like CIDRAP, for example, and the Vaccine Integrity Project, that's funded by I think Jeff Mackenzie Scott. Is that Jeff Bezos' ex-wife? She funded that. So there are still good people out there, and there are still other ways to get things done, and they're doing it. So I saw a question pop up there. Somehow it popped up on my screen, but it looked like Rick asked about the social determinants of health. So the social determinants of health are those things that really have the most impact on health. So everybody thinks health, they think doctors, go to the doctor, go to the clinic, go to the hospital, whatever. But that's not where most of people's health and wellness come from. It's from their environments, it's from their communities, it's from their housing, it's from their ability to earn money and to afford healthy food. And our community has made some great strides in addressing issues related to social determinants of health. The food system in this community is like one of the beautiful examples of that. I can't even remember how many years ago Healthy Champaign County started, and it has been going on, and gardens are popping up everywhere, and they're coordinating. And we have the amazing Land Connection and Sola Gracia Farm and Solidarity Gardens, and ours here, and it's really getting a ton of food out to people who normally couldn't afford it. But I always like to encourage people to think about policy, though, because if we had a policy in this country that subsidized fresh fruits and vegetables that people could eat rather than soybeans and corn all the time, you would see a lot of benefits from that. But there's just no easy answer. But the social determinants of health are those things that really make a difference. And in public health, Bill Fogg, who used to work for the CDC, he said that public health are scientific. Our scientific base is epidemiology, but our philosophical base is social justice. And I don't think that people really understand that but it really is. If you don't understand that social justice is the only thing that will ever truly get us to, the highest level of of health and wellness, that's what it is. You can't, we're constantly, we see the disparities and all that, and it's not caused by biological things. It's caused by racism, and it's caused by xenophobia, and it's caused by running people underground, and it's caused by stigmatization and all that stuff. So somebody had was there another question that just popped up? Sometimes they flick on my screen a little bit.
Yeah, there's several that are in the queue. A question that was asked earlier is, are there any bills that are likely to affect public health in Congress now or potentially in like state legislature that we should be aware of? Are there things right now that are like in the pipeline?
Right now, I can't think of any right now that's like something that we're really focused on either getting past or stopping. But there is a way that, now that you said that we do have policy level people at like Illinois Association of Public Health, for example, and we get a list of all the bills and we talk about them. We decide what we're supporting and why and all that. And that would be a good thing to get out to your group, I would think, because some of the bills that come through, I really just am amazed at some of the weirdness. A lot of times they don't make it very far, but they're just absolutely bizarre. Some of the things that people come up with to create a bill about. Not the least of which is making hospitals tax exempt when they're not. That's one.
Talking about
Oh,
money.
you know what? I'm going
Yeah.
to talk about tax exempt real quick, if I can, just for a second, because one thing that everyone can do, and I certainly encouraged this when I was at Clark Lindsey. So most people don't even know why the tax exempt system was set up. It was set up because it was supposed to be that the money that wasn't going to the government to do these services. Tax exempt organizations would be doing those services. So that meant that's when, when it first started, you would see a lot of churches, for example, or religious organizations that did everything from home visiting to feeding to housing, all types of stuff. We are so far away from that in this country that it is astonishing. And when I asked the group at Clark Lindsey, and these are all older people too, no one had any idea except for my former social work professor. He knew, but that's why it's set up. So one thing that people can do is start getting that into the conversation. We have problems in this community right now that need to be addressed, whether it's the housing crisis that we have, whether it is, the making sure that people are eating. Find out what is your tax exempt organization that you're affiliated with, whether it is your hospital or whether it is your place of worship or whether it is your club, whatever it is, and find out what services are they doing with that money that would otherwise, something that the government would have to do. And I think you'll be surprised that look at some of the mega churches. Look at Ornstein. They couldn't even help they could have helped. They didn't help during the hurricane. I mean, the places are so far away from this that I don't even think most of them understand why that was set up. It doesn't just mean that you do something good or that you're a church or that you're a good place. It means that you in Urbana, churches who own rental units do not pay property taxes. Wow. Do they use them to house people that otherwise the government would have to assist with? Because I know that, the townships are about, and the cities, but
if you're a church, you don't have to pay property taxes on your properties. I believe it's a very high number. It was Lily Wilcox was talking to me about it once, and it's like a remarkably high number. I don't want to throw one out right now, but
Yeah.
the percentage of properties that are off the books. Well, we have a lot off the books because University of Illinois and other reasons, but
Mhm.
if you're a church and you own rental units, you're not paying property taxes on them. It's a state thing. It's not a lot of our issues here are state things, right?
Yeah.
So it's not like the
Well-
city of Urbana could just be like, guess what? Time to pay
Yeah, no, it's the
Right?
whole tax
That's not
exempt
how it
system in
works.
general
Right.
is, and that it's so skewed. It's because
Right.
it started out as one thing, and then it's just kind of snowballed into something completely else. And if you're a tax exempt and you don't even understand what the purpose of tax exempt is really for, and so that's an issue. But we can ask places, what are you doing? What are you doing with the millions of dollars that you're not paying? How are you helping with the housing crisis? How are you helping with how much are you putting into that? You can ask those questions. You may or may not get answers, but you can certainly ask the questions. And sometimes just asking the questions over and over is helpful.
Yeah, and then speaking of asking questions over and over again, and I see that you talked about like firearm violence and motor vehicle crashes being top two killers for young people, and asking about what public health can do for prevention strategies with local organizations. And that kind of ties to what you were talking about, Julie, with maybe the tax exempt organizations or other ones within the community in partnership to provide those prevention services.
Yeah, well, so I'll talk real quick about gun violence because part of the issue with gun violence again is that the statistics, how they're kept, right? It's hard to get a picture of something, and this government is doing this administration is doing an amazing job of hiding data, of twisting data, of doing all that. But you should be able to always see what's going on, and we can't see it, so we're flying blind. For years and years and years we were flying blind on gun violence. And I'm not talking how many people die by a gun. I'm talking about how did they die, what was it, what was associated with that. I don't know if you've heard of like a social autopsy, but like what was involved that led up to that, and what agencies were involved in touching that individual, and what happened. But I'm talking about at the federal level. I want to know specifics of what kind of guns are involved in that. Just like we have reportable diseases that have helped us really get a handle on infectious diseases in this country, you could have the same thing with guns. But it's been just exactly the opposite at the federal level. And even though there have been, things that pop up, unless it's some kind of mandatory reporting and it's consistent reporting, and it's the same type, you're comparing apples to apples, it's really hard to get a picture on that to know if you're making progress or not, or if something's working or not. What we do in this country with guns is just again, it's something that's that's so weird that it's hard to even know where to begin. But I think that the beginning is to start getting a handle on what it is and what it looks like, and that would require Congress. Congress is the ones who told the CDC years and years and years ago they couldn't collect that information. So we need to demand that stuff is collected. That stuff that impacts people's lives, collect information on it, put the information out, and let researchers do what they need to do. Because it's the research that I don't public CUPHD. We're not out there like, oh, you need to do this because I decided so today. That's what RFK Jr. does. But what it really is you've got all these researchers everywhere doing research on things to tell us this is the best way to do this. If you have TB, you need to do this, 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 and this. So, if you're not doing research on it, you're not going to have those good answers. So.
There's two questions I want to kind of combine. Somebody asked earlier about the impact of increasing insurance costs, private insurance costs, and how that might impact public health. Do you see that as posing an increased burden on you guys, or has that been something you've noticed over your career? And then also,
it's going to be an increased burden on us in the sense that we are going to see more people living in poverty. We're going to see more people without access to healthcare. We're going to see more people go into the hospitals with active, about ready to die from tuberculosis instead of getting a TB test early, and then a bunch of people infected. We're going to see, it's going to be that type of stuff. It's going to be more suffering because all these illnesses lead to loss of work and lead to more poverty for a lot of people. And it's always those that can't handle it that are hurt the most. They've got enough going on. They can't handle one more thing. And I think people are going to be very surprised when they see if we don't get back to the ACA and how it should be. We're gonna just see more and more people not accessing care, not having access to it, and we're just gonna see all the problems with that, and all that will lead to that. How do you go from paying, let's say, $300 a month to, or $50 a month if you're subsidized, who knows, up to $1,500? You just don't do that. So you can't expect people to do that. And I don't understand the idea of, in this country, and I'll never understand it, why we act like healthcare is a privilege and it's not a right. I will never understand that. And I will never understand why people go against their best interests too. It's like they don't understand how a policy that they support negatively impacts them. So it's very frustrating. It's very frustrating, and I don't like seeing any type of disease or anything. I'll tell you what's going on with all these ICE raids. People are so scared that they're not going to even be going in for healthcare. And when you run anything underground, when you push it underground, whether through stigmatization or whether through fear or whether, whatever it is, when you push a disease or people that can get a disease underground, it makes it harder for public health to do our job, which is to prevent and to mitigate a case. Not to mention, just the suffering that goes on with that. It's just not right. It's just not right.
We've got about 5 more minutes here. Emily, if there's one more question you wanted to ask, because Julie, I'd asked her before to leave us with 3 takeaways. This has been a hugely wide-ranging discussion and presentation and questions. So either you had them in your head beforehand or you're what are 3 things you'd like to leave us with? But is there one more question, Emily, that you would, hasn't sort of touched on anything we've talked about?
Yeah, and forgive me if I don't know how to say this right. You said you have grants and state support to offset OBBBA or UBA. I don't know. Are there future impacts of this program if the grants are no longer available? And does that?
What was the program?
OBBBA. It's like OBBBA.
Oh, one big beautiful bill.
Oh, thank you. Okay, thanks. I appreciate the help. I was thinking it was something more obscure.
No, that thing is so full of pain and suffering that people don't realize it's coming at them. It's just I don't even know what to say about it. It's just so crazy. But again, I guess I'm an optimist because I always, am used to having these crazy things pop up, but we can get around them. And I think that people just aren't going to put up with it, with a lot of the stuff in that. It's going to be painful for a while, but I think that it'll, switch back. I'd like to remind people that the Gilded Age, which is sort of what we're in now, the Gilded Age led to what? The Progressive Era. So that's what I'm like. That's my big sparkly hope, is that we're going through this craziness and this pain and this, this cruelty, but it's what led to the Progressive Era. So, I'm ready for a Progressive Era big time right now. So that gives me hope.
Good,
All
good.
right, so if you were to give us a direction, as League of Women Voters members, what are things that are within our control that we can do to support public health? Is that,
What you already do. I mean, again, this community is amazing. The fact that, I have colleagues that never get asked in public health to do anything, because people don't care. They don't understand what it is. They don't pay attention. And every time I talk to my colleagues, they're just like, I can't believe that's what your community was like during COVID. And I'm like, I know, I knew they would be that way, but it is amazing. This community is smart. This community is kind. This community is we look out for each other, and we do. I mean, COVID, I won't even get into that because it was so amazing that I'm going to have to squeeze out a book about that one day, because this community was truly amazing. But just look at our food system here. People needed fresh fruits and vegetables, and public health said, because the research said that people need fresh fruits and vegetables and they're too expensive and they can't get a hold of them. So gardens are all over the place and people are getting food. They can't afford it. And all these different programs are popping up. Issues with housing. The main issue with housing here is we lack affordable housing. Public health's not going to go out and build houses. You guys aren't going to go out and build houses unless it's, for habitat or something. But we need policies that make it so that landlords cannot do the crazy stuff that they're getting away with, and that we don't have people coming into our community, buying up properties and then turning them into non-usable affordable housing for people. We have to have, and it can't just be, Champaign-Urbana, which Champaign-Urbana do a good job when you compare it to the surrounding areas where it's kind of like a free-for-all out there. But so we need that.
And one more. Your first statement was basically keep being involved in public health, being informed, finding out what's going on, that sort of thing. The second one I heard you say was keep supporting entities that provide food to those who need it in our community.
Well, or anything. I mean, we have some really good programs that are doing things out here. Just listen to what they need and then advocate for getting that. A lot of what we do are just kind of scraping together resources to get them out to redistributing things. So that's a lot of what we do. And it's wonderful. We have a food pantry that I don't know if everyone knows, but the Mosque and Islamic Center created a food pantry for CUPHD's clients in our lobby and in the back of our building. It became a joint venture, and we were able to put in a huge walk-in cooler. They have all the staff that do it. The trucks are able to back up, drop the food off, and a lot of this was food that was perishable. And a lot of food banks or food pantries can't handle perishable food because they don't have the staff, the clients. I mean, we have clients in here every day. We could put stuff out all day long. We usually put it out in the morning and we put it out at noon, but we could put it out just continually and it would be used. And so with the fresh stuff, that's important. So it's just like, look for what's doing it. But they created this food pantry for us. And not only is it helping our clients out, but it's helping my staff. Because those of you, if you haven't worked in a job, like as a case manager or as someone who's working with people who every day you're just like you're seeing needs and needs and needs, and you can't do anything about it. It leads to burnout. It leads to depression. It's horrible. And if somebody's in public health and they need diapers, we have the diaper bank thing here. We can go, case managers can go get that. They need food, they can get food 5 days a week. Not even if it's not in the lobby, they can go right back to the food bank and get the stuff from Sunday and get it to the people. If they need coats or clothes, they can get them right here. We don't let kids come in here or adults come in here in the winter without a coat on, where we don't ask them if they need one. And that type of stuff, that helps the clients too, because I mean, that helps the staff too. It really does. It helps with turnover. It helps with burnout. It helps keep people in the field, good people in the field. So, it's really helpful.
Great. And what was the name of the group that was providing food at the public health that you said?
Well, the Mosque and Islamic Center is who started it, but the food pantry that's here is called Friends of Champaign County Food Pantry.
Okay. Is there somewhere to get a list of all of the food pantries?
Well, there sure is. Are you setting me up?
No.
No,
I
well,
maybe
we
I just
actually have it
stupid
on our website. I really encourage people to go look at our website. But if you click on the CUPHD website and you go to it's called Food Resources. You click on Food Resources and it comes up and it's a downloadable, printable food pantry list in English, Spanish, French, Chinese, Dari, Korean, and Pashto. And you can click on where you can get hot meals and sack lunches. You can click on Champaign-Urbana, Champaign County, little free libraries, U of I, or mobile markets. And there's an actual map on there. That thing is kept up constantly. Oh, somebody put it in there. Thank you, whoever did that.
All right.
But yeah, so yes, we have them there. It's updated all the time. At least the online one is. The printable ones, they may take a little longer, but they're pretty darn close. So yes, those are on there. And we have all kinds of cool resources on there. You want to know you want to know how if the mosquitoes are spreading disease in our community, you can click on the little skeeter meter and find that out. So we have all kinds of stuff on here, data reports, prevention, education, all kinds of goodies.
So I would say a takeaway that I would add is go to your website because it's a huge source of information. I mean,
yeah. And websites are a little bit slower. If something is like that, we're putting it on Facebook.
Right.
Once I retire, they'll probably be doing it on Facebook and all 50 other things. But I only know how to use Facebook. So I'm still #boomer. I'm going to still be using that. But there'll be all kinds of cool stuff. And speaking of which, I am actually retiring. I have a date. I will be retiring February 1st. It's been in the works for a while, and it is a wonderful time to do it. I have had 30 amazing years at public health, and I couldn't be prouder of this agency. I mean, and this community. I am so proud of this agency. I mean, when I started, I think there were like 20 staff. We now have like 120 some staff. Like I said, our buildings paid off, 99,000 square feet on 7 acres. We have the ability to do all kinds of things. We always have a hefty fund balance because you never know what's going to pop up. And, we have a food pantry here. We have solar on the roof. I mean, just so many things that it's ready to go to the next level now. And, I may have mentioned before that we were going from doing a lot of outreach services, and that was really during my reign here, if you will. But the next is going to be doing a lot more community organizing and a lot more community health strategy. We need a lot of data. And thank you, everyone. It has been a real honor to do this, and I couldn't be more lucky. That's all I can say. But the next person that will be doing this will be very data centered. My deputy administrator right now. So I'm an MPH and an MSW. My deputy administrator is an MSW, MPH, and MD. And he speaks French. He's an immigrant. And if he is selected as the next administrator, just as I was the first female administrator in 70 years, he will be the first administrator of color. So, an immigrant.
Wow.
So I mean, it's all good. And while COVID was wonderful, and as a community, COVID sucked. Let's be clear about that. But I mean, as our community, it was wonderful to see how everybody came together. That will continue, and that's what did it. I got a lot of the credit for that. I was just the one out front. Everybody else is still here, and they're doing their thing, and it's amazing. And just like I said, we're losing money, and I have staff who have written grants and brought in about $250,000 for additional things during that time. So
Wow.
talented people who really are in it for the right reasons, and that's the key. So
Yeah. Well, thank you so much for tonight, for sharing that, for announcing your retirement to a group of about 45. That'll certainly be all over town tomorrow. If people don't already.
I'm and it's going to be just for the record, what'll happen is I will just leave. So I will just leave. I am not a one for any type of party or any type of anything. I told everybody, I said, I'll get the staff a cake the day I'm gone. I'll send this cake in for them.
Yeah, you better get out of town fast. I would.
Yep, and I'm going to still be in the community. And just before any of you ask me, I will not be serving on any boards for a while. So don't ask me. I've been asked about 100 times. I've been sitting on my butt for at least 25 years. So I am ready to do something. I'm ready to get my hands dirty and get back out there where I was at least the first 5 years of my career. So.
Great. Well, thank you so much again. Thank you, everybody, for coming, and hope to see you at the January, Keeping It Local. All right. Thank you so much, Julie.
Thank you all. Keep being amazing.
You too.